she is fantastic. I have met her and I did the integrative oncology course at Scripps. And part of that was just looking in Journey to find other resources to use integrative therapies in a manner that's conducive now that most of my journey was all surgical. And actually, I'm really one of those study participants, if you think about it. Even though I wasn't part of the study, I have benefited from the study. Taylor RX is a huge study. In fact, the chief principal investigator is Dr. Joseph Sperano, who is at Montefiore Medical Center here in the Bronx. And he has been a part of the multi-center trial throughout the country. And basically, they looked at independent individual tumor characteristics through Oncotype DX as a predictor of whether chemotherapy is beneficial or not in patients with early stage breast cancer. So the Taylor RX data has been compiled over the last several years. And this same month that we got confirmation that remission had occurred in a metastatic patient and is still, she is completely cancer-free. This individual case where they're using T-cell lymphocytes and targeting immunotherapy so that her own immune system is really now going after the cancer rather than blasting the healthy cells, which is something we've all really felt would be, what we wanted our patients to have. And, personally, when I had that diagnosis, it was something I prayed on from surgery till after, you wait for your results and you want to know, has it spread to a lymph node? What is my prognosis is really dependent on where has it been. Is it so isolated or is it gone beyond a certain point? But now we have so much breakthrough because even the staging has shifted. A lot of the oncologists, even for pulmonary. So last month, I also attended thoracic oncology program here at Montefiore, where there was a lot of precision medicine being indicated in regards to checkpoint inhibitors. There are a lot of this new class of immunotherapy, and it's going to be available for multiple types of solid organ cancer patients. So that it is just really enhancing. And they're all oral therapies. They are not chemotherapies in a way of infusion. They use the immune system, and they've had dramatic results where even in lung cancers, which we all know the statistics are still very limited. I believe very rarely is there like a 25 to 30% response, and we're happy if we get that. So to add something like a checkpoint inhibitor to a protocol has really made a lifelong, changes for patients across the board, where it's really about quality of life and survival benefit. So disease-free survival, right, is what people want. And, if we can really get to a stage like in that one individual case where it's complete remission from metastatic disease, all the the clinical support organizations like MetaViver and Susan G. Komen, and I think all of that was just like, they were texting out and tweeting when they heard this news, because it's like everything that years of investment into research has been hoping for is that we can now say that maybe 70% of the women in Taylor RX that were looked at that had received chemo, they really didn't benefit any more than using hormonal therapies. So maybe we can forego chemotherapy in those patients and now try to start to really look at targeted immunotherapy. And in some ways, it really is beyond a doubt going to be life-saving in many ways, because I know from personal experience, from dealing with a lot of the patients and their side effects from therapy, sometimes the treatment is worse than the disease. And, in that case, it's become a real game changer. So I think we're all, looking forward to know more innovative research protocols that might incorporate not just integrative protocols, maybe in addition to some clinical standards now that are changing, within this same month of June, I think that's why I was, I've been, a little procrastinating with Dan, and I think this is really something that spurred me. I said, this is so vital that we work on this and look forward, because the changes are just beyond belief, because I've been involved with clinical integrative oncology. There's a society, actually, Dan, that's based actually out of, I believe, the West Coast, and then there are a lot of East Coast participants who are researchers throughout. But it's a society of integrative oncology.
We should go.
Yeah, there's going to be a conference in October. I do plan to go to be involved more.
Here in LA?
It's I think it's going to be in Scottsdale, Arizona.
Ah, my second home state. Yes. Yeah.
It's a wonderful location to recharge and reboot as well, right? And get that energy vortex going, right?
Oh, October in Arizona. There's no better place. October in Arizona. Nope.
Yeah, and from some of my interactions, Heather Greenlee is a past president of SIO, Society of Integrative Oncology, and they had published some clinical practice guidelines for breast cancer survivors, in which they validated a lot of integrative therapies that could be used, with traditional protocols while patients we discussed a little bit of this, Dan, like when do you include some integrative therapies and when is it useful?
Mm-hmm.
And so this society actually put together some validated protocols and guidelines. And what was really quite interesting, since the Taylor RX data had just said, hey, chemotherapy didn't benefit early stage 1, stage 2 breast cancer, we can forego that. At that same medical conference of clinical oncologists, the ASCO made their recommendation to now follow these guidelines of integrative oncology. They actually recognize these guidelines. So they're really also then, kind of validating that organization and the benefits to patients, that if we're not going to go the chemotherapy route, we need to start looking more carefully at integrative options. So that was also a big shift this month, which I think is a month of breakthroughs, and hopefully continue to have more positive news and hopeful, exciting endeavors for new cases of research, but also for patients to really feel like, I can't give up now. There's more on the horizon. And I think anybody that's, have been in the shoes of a patient, this is just uplifting. I mean, initially, I have to say, I had some tears in the car when I was hearing the NPR study, because I said, this is something I had wished for years, that if my mother was alive, that she could have lived, and, you see these liver lesions go away. And I knew that I had been a physician, I had been a patient after my mother passed, but while she was alive, I had gone with her and been a co-survivor and saw all of the, the data and the CAT scans and MRIs, and to me, it's really reflective. There's so many women that are metastatic. I think the data shows that at least 1 in 3 breast cancer survivors, we're surviving longer, but 1 in 3 become metastatic. So there's a lot of people living out there metastatic, and it is requiring a new mindset into what other techniques can we use, what other research can we do to first, deal with a lot of things. Some of the integrative options, we're really looking at the chronic fatigue that breast cancer survivors experience. Some of us would say that's kind of because the immune system is hypervigilant and constantly, on the search for, cancer cells. So it's almost like, if you were having chronic allergies or stimulation from priming, from having significant allergies, your immune system is working overtime.
That's you.
And so when you're a breast cancer or any cancer survivor, or have some also, or if you have like a chronic systemic inflammatory disease like Lyme disease, or a hidden type of chronic multiple sclerosis, we really don't know, but the immune system has this ability to always be working, always be turned on, and that's really does cause a lot of fatigue, because there is that subtle fatigue, and it happens to people who have not had chemo, who've had surgery, who's not had, everybody complains about this chronic fatigue. And so the question is, does acupuncture, does reflexology, does, using Reiki therapies, are these all great ways to keep the energy system of the body also supplemented? How to balance those hormones that are also kind of affected by the therapies, So hormonal therapy seems to be still an adjunct, but, this great news about not having to blast women with chemotherapy so early on is quite a breakthrough. I just have had over the last 6 months at least 2 or 3 women. All of them are outside our national guidelines, where you normally say we're worried about women above 40. Most of these women now, it's like 31, 32, 35. It's definitely the genes, but it's also the environment. So, we can't think with our old tools. We have to start to have a new vision of how we can not just prevent, but also seek a more strategic, approach to helping anybody that's at high risk, because it shouldn't be that you just wait to suddenly develop something, because we do have a lot of the thinking and the know-how. It's just finding the right people to connect everything together and actually bring some of this information to the forefront, because so many of us are really taking our own kind of research and applying it to our own lives. I know so many patients look to me every day about other supplements and tools and herbs they use. And so I think it's great that the medical community now is embracing it more wholly, because, the body, mind, and spirit is all, necessary when you're, facing disease. And disease is really a delusion. It's not really a construct. It's really it's a category to imply that there's some, process, or the body's life process, whether it be detoxification or, there's something that's impaired in our body type, in our physiology, in our individual physiology, and very unique to just us. This is why uniquely now this concept, we don't know if we're going to be able to achieve that same kind of full remission that I believe it's a woman by the name of Perkins. She had dramatic breakthrough and is now living cancer-free. We can't seem to know exactly yet, because it's so precise. It really depends on that individual physiology. But you know what? It's really incredibly exciting, because then it means that all of the history of research in general have been population-based studies, which are large groups of individuals, everybody with breast cancer in one category. Well, that doesn't apply, because my cancer is different than her cancer, then different than hers, and my physiology is different, my genetics are, genomics are different. It's going to be so precise now. And the way that we have to look forward to this is really kind of almost now, I think oncologists are starting to question, well, we're doing this all wrong. It's like almost now totally flipped. If we've been killing all the healthy cells to get the bad guys, here all along we've had this tremendous, the body is, divinely gifted with, this powerful immune system. Why are we not harnessing it in the way that, higher intelligence gave us the ability to look and research? We have to use God's gifts and really enhance our own bodies to heal. And that's why, even this, the book behind me, the Healing Self, it's like, what are the other intangible attributes that, make people the healers? Who are the ones healing their diseases? Is it because they have strong spiritual mindset? Is it because they have a very strong social network? They're not isolated. We've seen that, looking at studies of, depression in cancer survivors and who's isolated and who shares more of what they're going through and how they survive. All of these things are part of, the picture, not just medications, not just, a protocol of 9 months of therapy. I think we have to look now at how we can change our mindset around how we design trials, right? Clinical trials. We'll have to think differently to incorporate this new stance. Checkpoint, it really was pretty amazing sitting with actually varied experts throughout the field of thoracic oncology. They all kind of met here in New York City for this conference. And across the board, I think, when we were talking about the traditional therapies and the very meager outcomes, there was just no joy in the room. I mean, it's very hard and frustrating, I believe, also for the clinical oncologists who treat these disease states to not achieve the outcomes they want as well. So, surgery is fantastic if it's isolated. However, these new checkpoint inhibitors, when we were discussing the outcomes and how now the biopharmaceutical engines, including these wonderful think tanks and biopharmas that are real startups, they're really tackling it from so many angles, and there's so many new checkpoints on the market that are being cleared by the FDA for use and hopefully for more trials. So I'm really kind of excited about the future of clinical oncology and how it truly is now a partnership and a collaboration with integrative oncology, and having that kind of validation and that stamp of approval from ASCO for breast cancer guidelines is really something that's now motivating me further to share what I've been doing in my recovery with other women. So, it's been really a wonderful month. Yeah. Not to believe that it's also very sunny here in New York now. Finally, that's a heat. But the East Coast is getting a little sunshine. So.
Finally, I know when I was there in March, it was horrible weather.
It was really very cold. So.
Doctor, have you ever read anything about Dwayne Wade?
Can you repeat your question?
Have you ever read anything about Dr. Dwayne Wade?
No, I am not familiar with Dr. Dwayne Wade. Can you tell me a little bit about him?
Yeah, highly recommended. It's very similar to all the information that you have there. There is actually, he passed away last year, I think. And also Louise Hay. Both of them have the same approach.
Yes, I met Louise Hay actually at our every year in October as well. Usually around that time, we have a integrative medicine conference in Scripps in San Diego. So actually, it was very lovely. It was
we gotta go.
It was my true honor to meet Louise Hay. She was being honored at our conference. At that time, she was exactly 90 years old and full of energy, and I have to tell you, it was the highlight of my experience.
Yeah, her best friend is this doctor. I actually think I misspell his name, but I can send you the information. He absolutely amazing. I actually got into all of this because of him, and one of his books that is called I know in Spanish. I have to translate the title, but amazing, absolutely amazing. They were best friends, Louise Hay and him.
Oh my God, what a best friend to have! I think if you get measured by the people that you surround yourself with, right, the kind of transformation your life can undergo really depends on who you associate with. Right?
Oh yeah.
Yeah, Wayne Dyer is his name. Wayne Dyer.
Wayne Dyer, of course. Yeah.
Yeah.
Wayne Dyer. He also passed away. He had,
Yeah.
I heard he also went to, I had heard, I'm not sure if he went to John of God in Brazil, because I know he was very open to spiritual medical intuitives. And I believe Wayne Dyer really is so transformative in helping people with a lot of the oncology, the psychology of mindset. And, there's so many, it's really all about higher consciousness thinking and mindset. And Wayne Dyer was just phenomenal with that in regards to so many different guided meditations. I've referred patients many years to try for anxiety, for depression. And so many of these tools are things that now I try to encourage. We have so many patients who, especially within this last month of having such high profile suicide and depression, mental health is really a big conversation. But I really find that, being someone who has been trained in an integrative focus, we have a holistic mental health provider in my office. I routinely recommend patients to a spiritual community in the neighborhood of the Bronx that offers free meditation courses and do stress management and meditation workshops. We really look at even guided meditations that are available. The Chopra Center meditation group have done tremendous 21-day meditations that are free to the public often, and then you can buy them online. They're incredible. So sometimes I will recommend a group of our patients to kind of join me in a meditation challenge. And then if not, every cellular, really the apps that are free online, Headspace, Om Vana has great guided meditation. In fact, it's kind of like part and parcel that it was not just things that I have learned about, but believe me, in my own recovery, when I was at Mount Sinai for my surgery, it was an 18-hour surgery. I literally lost a day of my life. And prior to surgery, I met with, at that time, Beth Israel had an integrative medicine program and a whole division. And they have an integrative therapist that works with you pre-op. And we did a lot of coaching around visualization exercises, seeing how the surgery was going to impact me ahead of time, not having fear, thinking of it in just that higher mindset. And a lot of the orthopedics department, as well as other surgeons at the hospital, were kind of collaborating with their team and seeing that they had better outcomes if patients had some mindfulness exercises and visualizations of their surgery before going in, and it created less trauma, less fear. And the truth is, especially if you're very much get into that discipline of a daily meditation, and you learn to incorporate not just the visualization piece, but maybe some movement, maybe some aspect of a real active motion in your vision, in your mindset, you can actually change. They have had patients undergo blood pressure management, as well as a lot of vital signs during their visualization exercises, and their blood pressures go down. TM, Transcendental Meditation, has proven to decrease, if it's done in a consistent manner, and it's been studied, a 20% reduction in blood pressure just from meditating, right?
Wow.
That's better than certain drugs. It's equal to or equivalent.
It's good.
Right? So,
yes, this is.
When we see a lot of people that have anxiety, and a lot of that anxiety will cause that pulsatile increase in their hormones, their adrenaline, and they get these spikes of blood pressure, then I know that they really need to engage in some mindfulness. Because that's what it is.
It's similar to the Tai Chi or Qigong. I don't know if have you ever practiced that. My dad practices, and he is 70 years old, and he's free of medication, and the same as my mom. She's a nutritionist, and she takes she eats clean. So she cure herself just by doing this kind of Tai Chi, Qigong, and then taking care of her food intake, and that changed completely her life.
It's such a big it's like it's so comprehensive, right? I mean, but it's so basic, right, that we don't think of it that way. I think a lot of the courses when we were talking, or I think it's Dr. Mark Hyman, he mentions it all the time when he speaks. Sometimes that when we take our pets to veterinarians, their number one question is, what are you feeding the animal, right?
Mm-hmm.
And it's like a majority of their intake in regards to the nutritional status of a pet is so important in what's happening with their joints or their body and such. But in medicine, we don't spend any time on what are you eating, what's your nutritional plan, like what is happening with stress eating, and there's so many components of eating and food security, and how the psychology of eating affects people in various ways. We never have that. I think in medical school we had nutrition, but it was a take-home exam. So that tells you, how much of an emphasis. I'm sure that was. I have to say, I have quite a few gray hairs. That was many moons ago. I would hope that there's more of a progressive nutrition program. But one of my big pet peeves is like GI, for example. Gastroenterology, which is a huge discipline, has just become a specialty where people just get their polyps removed, or they go for if they have an ulcer or H. pylori. But it's either to treat reflux, which not everything is reflux. I mean, nobody even thinks about the microbiome of the gut. I mean, that is really incredible to me, that I think every GI specialist should work hand in hand with an integrative nutritionist. They must have a nutritionist. I mean, if you're dealing with somebody's GI system and it's their, it's their first line of defense. It's the immune system is in the gut, their absorption is in the gut. All of their nutritional needs are not being met because no one's really discussing it. Even with that, I think just having somebody in an office where they collaborate with somebody. I think the goal, in the future, hopefully, is to have more health coaches and practices. I know maybe in the Kaiser groups, I don't know, Dan might know, but like out on the West Coast, I think they are incorporating more health coaches.
Yeah, they're pushing for that. Yeah, especially with groups like Kaiser, they find that it lowers the cost of treatment in the long term.
I mean, it's a no-brainer. I mean, in our, what I would say in clinical medicine when I was practicing about 7 or 8 years ago at the hospital-based practice is where we had the sickest patients. It was like we were on a hamster wheel constantly with patients. They get sick, they come out of the hospital, they come see us, they go back in the hospital. This is sometimes when your problem list is more than 10 problems, and majority on the top of the list, unfortunately, in the Bronx is diabetes, hypertension, heart disease, and then, unfortunately, there are patients who have that similar commingling of metabolic issues are then going to have other inflammatory conditions naturally, because when you have those big basic principles like metabolic syndrome, heart disease or hypertension, it's all about inflammation. And what the commonality is, it's cardiometabolic dysfunction. And from that cardiometabolic dysfunction, you're going to have inflammation in your arteries, you're going to have inflammation in your gut. If no one is addressing your nutritional needs at the lining of your intestinal lining, and you're getting leaky gut, maybe some of the undigested materials are now going into your bloodstream, your immune system is all of a sudden attacking these frankenfood, particles that are coming out of our processed foods that we, are surrounded by, and it's difficult and it's really expensive to eat clean, but I think now with CSAs everywhere, even in the East Coast, I have to say, it's exciting. I was at Mount Sinai the other day, and the medical school, the ICANN medical school, I was really impressed because they had all the medical students and residents, I believe, have community-supported agriculture, and they had the most beautiful greens, that just came straight from the farm. It's shifting, but I think it takes a lot of individual groups to kind of get the ball rolling. But something like this cardiometabolic dysfunction, they've seen it across the board, that when that immune system gets triggered like that, over time, it doesn't have to just be diabetes. It can then start to cause inflammation where there's eczema, psoriasis, there's some type of autoimmune focus. People are going to lose hair. They're going to have alopecia, that's more related to an autoimmune focus. They then see that a lot of autoimmune patients, people that have then, their immune system got triggered to such an extent, they may have lupus or some mixed connective tissue disorder like, Sjogren's or scleroderma. And all of those patients have a high propensity to have cardiovascular disease. They have cardiovascular disease too, because it's all like that common place. And the common place is the belly of the beast. It's that lining, our intestinal linings and the immune system attached, and the two different pathways in which we respond to it, the Th1 and Th2 pathway of protection. If something gets triggered in the wrong direction, you might develop cancer. You might develop an autoimmune disease. But it all starts with inflammation. And so sometimes it's really just basic. If we can get back to eating clean and teaching, and like even tomorrow here in the Bronx, which is exciting, one of our staff members, Nathaniel, is a vegan, and his goal is to be a vegan chef in the Bronx, which is something that is quite, a great, idea and concept. But he goes out regularly to teach in the community. Tomorrow they're having an event along with a lot of wellness practitioners. And, it happens, just like that, a movement of individuals who are committed that other people get the information, learn how to apply it, show them how to create very low-cost, healthy, clean meals, and find other tools that might work, because it's majority of it is food, but it's also mindset and how we handle stress. And being on the East Coast, that's something I think we're experts on, is stress. We have so much stress here. It's like, the energy shifts when you go right out the door from the airport. You can feel the difference, Dan, right?
Yeah, you can.
It's like we vibrate differently here. It's like everything is at this crazy pace. It's like, it's often hard to slow down. It's really hard to slow down. Like, you get so used to living at a certain pace and having everything in a New York minute. But, it's not a great way to be, because you just can't be present. You can't take in, the moment in a right way. Like, you can't even just sit still and just be, which is like, oh, you're wasting time. This idea of time is how do we enhance quality time, and how do we live it in a way that fulfills us to our highest purpose, rather than finding that, I'm chasing my to-do list and trying to get a million things done. How do you live a more whole experience where you're fulfilled, even though you didn't check off all your boxes, right? How do you really make it work? And that's why I think I've been more than excited, because to me, I think choosing this path in medicine is a way for me to heal. Because I think more than anything, our healthcare system is dysfunctional. Our healthcare providers are burnt out. Our healthcare initiative in regards to innovation, there's not going to be any innovation if there's no army of new thinking, people who are out there kind of connecting like this and discussing other ways that we can challenge the system and change the way insurance companies see healing and health. Because to me, it's incredibly disheartening that, the Medicare system, I think recently we were getting the accounting from, and I have a background in public health from Columbia. After, I had kind of always wanted to figure out and learn about health policy, and I never knew when to kind of fit that in because medical school is such a long process. So I never really felt like as a medical student that I knew enough about insurance and healthcare. So I waited till after I was done with my residency, and actually that was perfect timing. And at Columbia they had a talk about high strung. I was working full time. I did my Columbia master's program while I was working full time as a physician, and I was pregnant.
Wow.
I was pregnant each year of the 2 year program. So I think those were my biggest accomplishments, my boys. But I have to say though, health policy, it's all about how it's reimbursed, right?
Yeah.
So if we change what is reimbursable, the payers and the providers of healthcare are the insurers. But the biggest insurer is the federal government, right? So CMS and Medicare and Medicaid are the biggest payers. And you know what? Right now, they only have a disease system that they work on. So the sicker you are, the more it gets paid. If our incentive was to be healthier and to be using a health coach or to be using, clean eating and nutrition as part of the mindset, it's like we can sustain this.
And it's cheaper.
We can't sustain this model of disease health because the accounting office just said, I think maybe Medicare will be unsustainable in my lifetime, maybe in the next 15, 16 years.
Yeah, the next decade. So how do we change that?
It should be preventive instead of being just taking care of conditions.
So, I
and it's
kind
cheaper.
Of in my own way I still take insurance, but I am kind of struggling with that because I try to do this integrated model in the amount of time that I can do it, which is more time. You really need to spend more quality time. But I do think it can work because you just need a model where there's a team. And if there's a health coach doing maybe a group class of teaching with diabetics, right, in a group, where instead of teaching in a there's no time to teach in a regular traditional office visit.
No.
And what they do pay for is not that kind of treatment where it's one-on-one. But I know that a lot of the integrative offices have looked at group classes, maybe doing Skyping videos online where they do more of their health coaching and the teaching and the public health messaging around just coaching. Because to me, I think the hardest part is not having a coach day to day. Like diabetes itself is like a lifestyle change. It's a whole lifestyle change, and it's like you would need like a navigator. I think they're looking at navigators even for helping with clinical patients with oncology, right? And a patient navigator is someone that guides you and assists you. And wouldn't it be amazing, like, if somebody also called you up to remind you to make your green shake, to make your wheatgrass in the morning, or we have to take some personal responsibility, but the healthcare system isn't designed to be supportive in that way. But the private offices that have done it, that's what they're more successful in, right? That's why subscribership to videos on YouTube have gone up, because people are looking for guidance in a way that makes sense, but also they want it to be validated by their doctor, and somewhat helpful to have something that's middle of the road where people are finding it's not like hearsay anymore. I think we do know that curcumin and turmeric definitely have amazing health benefits. Some of it's being looked at in research for cancer as well as other inflammatory conditions. But, before I think there was this real concern, like how do you go out and recommend these things and, make claims on, in a way. But I think what we can do is really guide people in what we know is valuable. And I think lifestyle modification is the key. And it's exactly what we were discussing, having energy work that you're involved with. How do you do stress management? Is that through a Reiki class? Are you doing yoga? Are you doing Qigong? When I had surgery, not only did I do the mindfulness work, it was really kind of interesting. I picked a very small, I could have gone to, Sloan Kettering, which is like the Marvel in the East Coast. It's like, and my mother did have consultations there. So, I just found that it became so impersonal there, and it was just so large and cumbersome. It became like a warehouse of patients, and in some ways, I think walking in the steps of being a patient, now I know what I like. I want someone who really kind of treats me like a human being, that's individual, that's personalized, and it's just a loving environment. It's not such a huge office where I'm in a waiting room full of like 50 people. That can be very, stressful in itself. My girlfriend just had MRI imaging last week, and we were kind of surprised to see that they found a tumor in her bone. And, I wasn't able to go with her to her consultation with the orthopedic oncologist. So, there are these subspecialties where they really look at the bone tumors. And, I knew she had to have more imaging done at the end of the day. So I was in touch with her, and I went to show up at the MRI suite, because let me tell you, the worst thing is being in that hospital gown waiting for your results. So, these are little things, but they make a huge difference. So at Sinai, they had a smaller breast center that had just kind of came together. It was very intimate. It's a smaller pod of, things, but they do make it comprehensive, where you don't have to run around the entire hospital to get all those services. They bring everything closer to the patients, which is also something very important, because you have to run to one building for this, run to the other building to see your surgeon, and then, sometimes also, go to get another consultation done with another specialist. They try their best to kind of keep everything together. And the other key, which I really was excited about, was they had Reiki massage therapists.
I was going to mention that.
Yeah, they had Reiki massage therapists on staff.
Wow.
They also had
oncology massage. They also provide now oncology massage.
I did not hesitate, and let me tell you, I made a lot of decisions. I think that were good decisions when going for such comprehensive surgery. It's like, I really needed the supportive environment. I had people that stayed with me overnight and made sure I got a bigger room, and I had some of those benefits of really kind of feeling cared for, in a right way. And I was particularly happy to take advantage of the Reiki massage therapists, which I don't know if a lot of people are calling them in-house. They have them in the clinical breast center called the Dubin Breast Center at Mount Sinai. Mm-hmm. And the nice thing was, I called that massage therapist to come up to my inpatient bed maybe 2 days after I had aggressive surgery. I had about 8 Jackson Pratt tubes coming out of my body, because this was bilateral mastectomy, and I did a deep flap. So I had a large abdominal incision, from which they transplanted my abdominal tissue to create the new breasts, and it was a tissue transplant. I was on anticoagulation. I had huge, I think a bunch of different IVs that I was dragging around. And, for me, the hardest part was just really the first few days getting out of that bed and sitting in that chair. That was just a struggle. And then, of course, the experience, even if my body felt complete, because I woke up still having flaps on my body. So I did not have the experience that a lot of women go through after a mastectomy, where they may still have to wait to get an extender and they are not completely done. So there's this, even with the flaps on, I mean, there's this huge sense of loss. Like, you feel like a part of you is missing. And it's really very emotionally difficult. I didn't know how difficult that would be. But, you know, I have to say I have a colleague who's an acupuncturist who had collaborated with me many years in my practice. She came to my bedside. This was not through the hospital. I had asked her to come to the bedside, and she put seeds in my ear. She did the ear acupuncture to help me with pain. I was initially on a PCA pump post-surgery, and I had to spend a few days in the ICU because I had a little prolonged intubation, because it was just such a long surgery. It ended up being 8 hours more than they anticipated. So I was so happy to have her do the acupuncture for me. And I will tell you, it helped me get off of any of the narcotics, which initially was through the IV. I was only on, if any, like anti-inflammatories like NSAIDs, and I used the acupuncture that really grounded me and supported me in the care. And when the Reiki massage therapist came up to the room, they did the massage while I was, limited to the bed, and that was really incredible. Your spirit. Really
wow.
I have all at home because
it was a very different hospital experience, which is different than even having, I think, those kind of services while you're outpatient is kind of easier to kind of navigate. I was really kind of pleased with that. That was really quite good. Every day I would meditate on the fact that I did not want chemo. I focused on the fact that there would be nothing in my lymph nodes, and I was really clear, because I knew that that's what the surgeon would really focus on, is what's in your nodes. And if there's something's in the node, I was sure that that I really didn't want chemo. And it was not just for the sake of seeing my mother suffer through chemo. I said, this is going to be different, and I really felt that I could focus my energy on that. I did, though, right before I was there for about 7 days. So my breast surgeon was able to come in, and she, told me some of the results. It was fascinating, though. I did have 1 micromets to 1 lymph node, which is a micrometastasis, is probably like a millimeter within 1 node, like a few millimeters of tissue. But Dr. Hoffman clarified this for me, which, was nervous, now after the fact. The micromets, she said, was a blessing, because it wasn't really considered as high in the staging, because I was still a stage 1. It might have made me a 1B instead of a 1A or whatever. However, it didn't matter, because the genomics were really the underlying factor. I had this aggressive surgery, removed not just the breast that was affected and the nodes that were affected, but also the prophylactically removing the other breast. Partly because my mother was 32 when she was diagnosed with the breast cancer, and I was 42. I was convinced, even despite having multiple genetic tests, that even if my test for BRCA was negative, I'm sure the medical community has still not discovered the kind of genetics that my mother and I both have. And there is some other genetic mutation that would cause such an early stage of diagnosis, which really made sense to me, that there was something impaired between our genetics. It wasn't just coincidental. And it's really very good, because after the surgery was done, they do the genomics on the breast tissue that they've removed. And that's really the most effective. Sometimes they can do the blood test now. There's so many different genomic tests. I think Dr. Huffman said Myriad makes, there's MyRisk, there's so many, I think there's Mammaprint, and then there's Oncotype DX when it comes to genomic profiling. And, he says there's even more genomics now than they did even within my 4-year window. It's like exploded. So even now I can probably screen for more things that he said about 4 years ago they may not have had. But, I was vigilant, and I was an advocate for myself with my oncologist. I will tell you that it's very hard being a cancer patient, because I realized that I had a little bit of an advantage. Not because I was a physician, honestly, but because I was the daughter of someone who had cancer for 23 years. I was a co-survivor with my mother, and I knew the ropes. I knew all the chemotherapy protocols even before I became a physician. And, some of it really prepared me for the conversations I had with my oncologist after surgery. So after you've done with your surgery piece, you usually follow up with your results and see a medical oncologist, and then they decide what will be the course of action, what's the protocol for you based on all the data they've received through surgical treatment and staging. So we sat down and had a conversation, and she started to rattle off chemotherapy protocols, some of them that were 30 years ago when my mother had breast cancer, adriamycin, which is so cardiotoxic, CMF, Cytoxan, all of these regimens. And I'm thinking, I said to her, are you really going to give me something so cardiotoxic? I'm a young patient. Is there no other protocols you could think of? That's it? That's all that's changed? Because to me, I was really encouraging a conversation, because I don't want to be told this is your therapy. I want to know what other options are there. And there are. So I had a conversation, and my oncologist at Mount Sinai was Harvard trained. She was, in regards to having the right credentials, would impress anybody who's a physician. But to me, she didn't hear what I had to say. She didn't listen to me, right? She spoke about all the new data in regards to total hormone ablation, right? So that's basically years of data have shown that 5 years of tamoxifen, as well as many of the other anti-estrogens, are really now standard of care. And they've really looked at total hormonal ablation, even using Lupron and other agents, to do even more to eradicate all the estrogen in your body, right? Because you know what? Estrogen's the enemy. But what if we got it all wrong? Maybe it's not estrogen that's the enemy. Maybe it's the fact that the toxic estrogen, there's different forms of estrogen in our body. There are some estrogen receptors in my brain. If I don't have those, I'm going to be very foggy with my patients all day. So I was very clear that I want to know what else can I do, because I'm premenopausal. I'm not, going through any menopause, and estrogen has other benefits and has obviously, negative effects. So is it really the estrogen, or is it the balance of estrogen? Is it the fact that my liver may not be good at detoxifying the unhealthy estrogen? Maybe I should improve the detox pathways of my system. Maybe my DNA doesn't repair well. Maybe there are other ways to look at this without saying it's just about estrogen. But I also had just, had surgery, and I was 42. I have 2 boys, and I had a little bit of a regret for a moment that, maybe I still had, if I had the opportunity, would I still want to have another child? And, I sat with her and had this conversation, and she's just talking about getting rid of all my estrogen. And I said, wait, I want to see a oncologist. Now they have reproductive oncologists that help women with these situations. And thankfully, I'm lucky in the fact that, obviously I've had 2 healthy pregnancies. And, I started to say, maybe the shop is closed, maybe it's not for me. But I still think that a doctor should listen to the individual, right? Because it really should be to my choosing. If I can still have and conceive, I should have that opportunity to have that conversation first before you put me on something that's going to impair my fertility forever, right? Those are questions I think that women don't dare discuss, but that's very important.
Wow.
I have 2 or 3 patients now, 31 and 35. Sometimes now they can harvest the eggs before they're doing chemo. And it's fantastic because these women have had, and even Dr. Hoffman shared with me, they have had very successful pregnancies after therapy. And so those are things that, are very important. But when the protocols are just moving in a direction that it's all looking at one thing and not being as complex as the human body is, then I think we're missing the boat, right? It's not always one thing. It can't just be estrogen. Just like for prostate cancer, it can't just be let's eradicate all the testosterone.
Yeah. Doctor, that should be your book. That should be your book about it, because some people don't even know what to ask or what to do when they get cancer.
I really feel that way because I learned kind of the hard way, and also that oncologist from Harvard, after I really had that kind of falling out, I ended up going and finding an oncologist that seemed to understand me and my mindset around integrative therapies, and understood more of that. Dr. Barry Boyd, he's in Connecticut, and I went to see him, and he had a different outlook. He said, look, you're younger, there are all these clinical decision-making tools actually that are available for oncologists, and he was able to put my information in, and he's like, these are all the different protocols, and this is what I would offer, but it would really be up to you, right? And so that's what you want to hear, that ultimately you were a partner in decision-making.
Patient centricity. Not only should this be your book, this should be your blog, and this will be your blog. We've got to get all this stuff out there.
I always said, the one thing that really reflects on me is that it's not my mother's cancer. So why am I following these old thinking? And I felt personally validated when ASCO finally said the integrative oncology guidelines are good guidelines. They should be used, because otherwise everybody looks at you like you're doing something, and they put fear into your heart when you leave an office and you've decided not to do something. Maybe you've done something in your benefit, and patients should be encouraged to look at all their options and not just be handed, kind of their fate on an order slip about, what is going to affect their life.
Right.
My mother suffered tremendous side effects from every clinical protocol. There was never one that didn't. And, one thing I knew is that I would definitely be vocal and, be an advocate for myself. So I even literally told the oncologist, because number one, she was having a conversation with me about chemo, and we did not receive results back yet for my genomics. I said, well, we can't have a conversation without the genomics, because the genomics are everything. And I cited this whole oncotype trial, and last October I was lucky to be seated right next to Dr. Sperano at a breast cancer update at Montefiore, and he's one of the principal investigators, obviously, for this Taylor RX that not just showed now for stage 1 and stage 2, but also they're looking at DCIS, whether we're over-treating ductal carcinoma in situ, which is considered stage 0. Some of this stuff means that maybe we can limit how much disfiguring, surgery. I made the decision partly because I know there's a genomic component that's different. And Dr. Hoffman was very helpful. Last year I ordered labs on myself, and none of my oncologists did. But I used some other integrative tools, and I found out that I have the methyl tetrahydrofolate reductase genetic mutation. and it's not a homozygous mutation. I have one impaired pair, but that is completely related to DNA repair mechanism. I have impaired detoxification. So I need to focus on improving detoxification, and I found so many different techniques, including using detox protocols that are integrated from Metagenics on a quarterly basis. You can do a daily detox using a lot of those tools, or wheatgrass, spirulina, and different things to support your and healthy methylfolate, because the goal is that you're not a good methylator. I'm a poor methylator, and being a poor methylator has a big outcome in how my body can handle a cancer cell. I might be able to repair the mutation that other people repair easily. And so maybe it's not about estrogen, and that's, I think, clearly relevant to me. But I almost found that I couldn't even have a conversation, and without really saying about the genomics. And surprisingly enough, as hospitals go, something happened and they delayed sending out the genomics. I couldn't believe it wasn't ready. It was my month follow-up after my surgery, and they didn't have the data. So I had to wait another month. When I was in waiting for the surgery information from the genomics, it was like forever. When you're waiting to find out whether you have to get chemo, it's like waiting forever. And the other thing is, sometimes, the offices are so routine, everything is done like clockwork, where they don't seem to understand that it makes you feel like you're just a number, right? They had started to recommend tamoxifen. I did try tamoxifen. I had severe side effects, and I could not tolerate tamoxifen. That was also part of my interest in the integrative oncology with Dr. Liz Oshler. She's a naturopathic oncologist, and it reaffirmed for me other ways that I can reduce my unhealthy estrogens without having to take the tamoxifen. But before even taking the tamoxifen, the office ordered a bone scan. I was 42. Why do I need a bone scan to check for osteoporosis? Oh, because it's going to be my baseline, because when you're on the estrogens and the anti-estrogens, it's a risk for osteoporosis. So you see, we're doing everything backwards. We kind of almost prepare patients for the outcomes of the negative side effects of our treatment. I mean, there was no reason for the bone scan. The bone scan is the bone density. I'm sorry, not the bone scan, but the bone density. Bone scans are used to see if there's metastatic bone disease. But a bone density for a 42-year-old healthy woman is no point. If you have you should not have low bone density unless you have thyroid condition, you're a smoker, you have some other metabolic disease. But because you're replacing me on tamoxifen, and tamoxifen is going to erode my bone, you're basically looking at my baseline bone density.
Yeah.
That shook me up, and I said, you know what? Another reason for me maybe not to really think about this in the right way, and I have to really have my wherewithal. And being someone who had a deep flap, there's a very short window where you can make that decision. I really didn't have any other areas in the breast that had other lesions. I was very isolated. It was comprehensive surgery, but I literally did that and did the whole reconstruction at one shot. What was irritating to me in the conversation with the oncologist was she kept talking about radiation. And I said to her, I can't radiate this tissue. I just spent 18 hours of surgery. I said, you're talking about going to see a radiation oncologist for what? I said, I'm not having any radiation. I didn't go. She was really fixated on that micromets, that few millimeters of a micromet.
Wow.
And I said, that's going to kill my tissue. My tissue transplant it'll destroy the tissue transplant. So I told her, no. I said, we're not making any decisions again until I get the genomics. And sure enough, when I went back, actually, you know what? it was really unfortunate. She didn't call me back when the records were ready. What happened was I then got a phone call from the office where they set up an appointment with the radiation oncologist again. And I said, wait a minute. I said I wasn't going to see a radiation oncologist. Why is someone calling me to set up this appointment? So I called them back and I said, I think you have a mistake. I am not seeing a radiation oncologist. I don't know why you've scheduled an appointment for me, or I would like to know what the results are of my genomics, because it makes me concerned because you're calling me about an appointment without my doctor even talking to me about the results. That is very stressful to anybody. So why would you not have my doctor first call me back about my genomics and then discuss other things? But we were supposed to have a follow-up face-to-face, so having somebody call you on the phone and, just mention something, again, this kind of speaks to things that only a patient understands, but that's like nerve-wracking. I was like, my God, are my results bad? Why is she still recommending radiation? Am I going to have now scar tissue that's not going to heal because I'm going to have to do that? So many thoughts go into your head.
It's crazy.
And Wayne Dyer will tell you, right? That was his mindset. One negative thought attracts another negative thought, attracts another negative thought. And, already in the mind of a survivor, this idea that things will come back is always there to haunt you. Mm-hmm. And so, you do not want any kind of unexpected news like that. So, it was horrible, but I had to be a little defensive, and I was very upset with the staff. And I said, please have my oncologist call me back with the results before I speak to her about anything else. And she did call me back. And you know what? The blessing in disguise was my results were very favorable. At that time, and in general, the scores are there's a number score you get, and basically anything in a low range, very low, maybe under 10 or 15, is considered really very low risk. You have then intermediate risk, and then you have high risk. So at that time, that was the interpretation. If you're very high risk on your genomics, then the chemotherapy may provide you some benefit. If you're intermediate risk, it was kind of in the gray area still. But if you're someone like myself who was out of the range, it was 10 or 11, great news. Great news, Dr. Rafique. You don't need chemo. I was like, oh, then what was this phone call about? Well, and I said, listen, save it for someone else who needs radiation. Don't waste that appointment on me. I'm not going. So, it's all such a journey, but I agree with you. I'm very inspired to share what I've experienced, mostly because, there's so much knowledge, and sometimes it's also me discovering things for myself. Dr. Hoffman gave me some benefit of understanding that, when I did my sentinel node mapping before surgery, he said, that micromets may not even be a micromets, because when you do there's a pre-op test where they have a dye, and the dye goes from your breast tumor, and they map it to that first sentinel node. It's kind of a radio tracer, and it's done through nuclear medicine at the hospital. Sometimes he says part of that sentinel lymph node mapping system will kind of drag out some of the cells to that first lymph node.
You know this?
No, but I can imagine.
And then in some ways he said, the micromets, not a big deal.
You and Hoffman are elusive. When I get you guys, we go for hours because we get weeks of content. But you've got to do more of this.
I'm really excited now. I think I could do this on my own.
Yeah, we get this first one in the bag. It's a good test run. Actually, we'll have tons of content. I don't know if you have Instagram, but we can share it on ours and tag you. And we'll slowly start building out your platform. And that book, Monica's got a great idea.
If this,
I'm excited, Monica.
yeah, if this was your book speech,
Keynote
I
for
will
the
buy
book.
it.
Yeah, I would too.
Really.
Well, I
Very
met her. I
interesting.
met Dr. Rafique in person. I told you about her when I went there.
Yeah.
I told Monica about you right after I met you.
Oh, that's great, Monica. I can't wait one day to come out there and really enjoy it too, because I think I agree with you. I think, personally, I have to say when I was told that I had cancer, right, that conversation, and, I even told the resident who called me from radiology, I said, you can't say that before you tell somebody they have cancer. You don't tell them to sit down, because then I already know it's bad news. Because I wasn't expecting any bad news, right? I was expecting good news. But when she called me and told me, I really didn't have that kind of moment. I really was a little disappointed, for sure. Because, doctors, we like to get our diagnosis correct, and I was incorrect. I thought I was going to be fine, that maybe it was just something benign that developed. But I have to say, though, I had that conversation immediately in my mind, and there was something very spiritual in that moment, because I said to myself, there is no one else more well prepared for this than you. And it's almost like I had to walk in this role in order to get to this next stage of what my higher purpose is. And so I've embraced it fully, and I really I think when you do that, I think you heal immediately. Because, it's like then the cancer doesn't have you. It's just you are here to face the journey, and it actually has been so meaningful, and you live your life more fully, and it's been such a gift. So I agree that 100%, if I can be a voice to help others, understand that, this cancer has been a gift for me in my life, and I think we're now on the verge of really giving a lot of women their life back.
Yeah.
Because things are really moving.
You could feel a paradigm shift even in the industry.
Yes.
Just a little bit of oncology work I've done this year has been crazy as far as new treatments and immunotherapies. So it's the first year I'm actually involved in cancer. So I think I came in at a right time.
Yeah, and my husband he's a biochemist. He's a researcher. I don't know if I shared that with you, Dan.
No.
But, he works for Regeneron, and
okay.
Huge immuno-oncology is like a huge thing, and they're very excited about it. They have a huge genetic mouse program, and
yeah, that's crazy.
Sanofi. So Sanofi is their big partner.
Yeah, and Hoffman and I are working on some exosomes, so there's a whole bunch of stuff going on.
Exosomes as well. Exactly. So I'm excited. Thank you so much for encouraging me and supporting me.
Absolutely.
On this, and Monica, it's such a pleasure meeting you. And
nice to meet you too.
It's making me excited to look back on my picture with Louise Hay, because I have to say she was so beautiful to be around that energy, and so God bless them both. Those spirits are infinite. That's the other part of going through any of these spiritual workshops and learning more to be comfortable with your spiritual life. You realize that nothing really gets destroyed in the universe. So, that energy and that relationship is infinite. So it's fantastic.
Well, this is the first of many. We'll be in touch. And we got tons of content, so we'll be in touch off the air as well. But thank you very much for everyone watching and listening. Thank you, Dr. Rafique. Thank you, Monica, and we'll do this again soon.
Yes, thank you, Dan.
Take care.